46 years old. I didn't come out until 2 years ago for many factors, fear being one of them. 30 years ago, when I had the opportunity to first come out, there was no resources, there was no support.
I have been in practice for over 17 years. I encountered in my practice many LGBT patients, and some of them were skittish about coming out. It opened my eyes to some of the struggles that my patients then were having.
My doctors used to be really nasty and cold and quick, just what's wrong with you, what do you need, and that's it.
People have told me terrible stories, and so I try to reassure them that I have information about their health that's evidence-based, that I use good resources, and that we can have a real conversation about who they are as a person.
I recall recently walking into a hospital for my first consultation and giving the person my driver's license with my information on it, and they created a little card for me for the hospital with the wrong gender mark. That was a choice that they made on their own, not from the information I had. That, to this day, bothers me, and it goes back to educating your employees, your staff members. Don't make assumptions, don't make your own judgments, don't judge.
My sexual identity has made me more aware of dealing with providers and knowing that when I walk into a room with a new provider, I may also have to help educate that provider.
As someone who grew up as part of the LGBT community, I found LGBT-sensitive providers to be hard to find and sort of a challenge, and I wasn't particularly comfortable talking about things. And so when I became a doctor, that was what I wanted, was to provide care for our community.
More often than not, unfortunately, folks are met with judgmental tones or longer wait times, or don't feel comfortable being open with their providers or any other staff at our hospitals about their sexual orientation or their gender identity or other information that might be really relevant to their healthcare. And so, it's our job as healthcare professionals to make sure that we focus on these types of barriers to people getting comprehensive healthcare.
There are a few barriers to healthcare that LGBT people experience here in New York. One has to do with identification. Does your ID look like you? Does it have the same name? Do the social security numbers match? The other issue is health insurance. Having it, not having it, what will it cover? Does it cover certain surgeries? Does it cover certain procedures that some insurance companies say are cosmetic, but we know that it's vital to mental health as well as physical health and well-being?
Often LGBT health is stigmatized by risk, particularly for gay men. As someone who came out during the height of the AIDS epidemic, everything about my health came back to AIDS. Was I going to get it? What was going to happen if I got it? All of those things. And so feeling like that was the only thing that was important about my health was that I should not be having sex. I shouldn't be having sex without condoms. I shouldn't be, right? There were lots of shoulds involved, and very few of them took into account like what I wanted or what was happening in my community. And it was really this sort of medicalized views. I sort of learned to compartmentalize what I was going to talk to my healthcare providers about, and then what was actually happening in my life.
If I were speaking to other providers, I would say we have to stop being scared, and we have to really listen to the patient and treat the patient for what the patient is here for. It might be something new to us, but if it's on our patient's agenda, we need to learn.
Everybody has different needs, so treating everybody the same isn't necessarily giving everybody the treatment that they're there to get or the treatment that they want. And so taking our time to get to know people and understanding how to ask questions about what people may need that may differ from what we're assuming about them.
I've been at Health and Hospitals for more than 10 years as an attending provider, and I've seen it change a lot and become a lot more welcoming and a lot more affirming. And I'm really proud of the direction that we're heading in, and I really think that we're going to be a leader in LGBT healthcare for the foreseeable future.
Oh, I recommend them 100%. The New York City Health and Hospitals are the best.